Hello and welcome to Unlocking Health with Dr. Lexi. And today I have Dr. Valorie Prahl here with me, and she is a doctor of chiropractic as well as a certified clinical nutritionist. So, Dr. Prahl, I'm glad to have you here, and I'm excited for what we're going to talk about today.
Yes, I'm excited to be here too. This is great. Great to have an opportunity to dive into a process called methylation in the body. But I'm going to start with just a little bit about my history, if that's okay with you.
Absolutely.
So, I just want to tell you that I've been in active practice for about 38 years. Working with a lot of people over that time. And, after several years, I felt a lot of frustration in my practice because people would come in year after year with the same problems. People felt good in the moment, but the processes wouldn't hold. I wasn't fixing them. It was just kind of frustrating. I always had a great interest in nutrition, so I traveled all over the country taking classes in nutrition. And I'll tell you, I thought I found my holy grail, right? Everybody was going to get better if they just took the right nutrients. And to this day, I still offer and give a lot of people different nutrients. But then as now, there were still patients who wouldn't get better.
Right.
I couldn't fix them, and I couldn't figure out why. Somehow I felt like I was the one personally responsible for their health. And I wondered, where was this resistance coming from? All the while, I was gaining weight, my joints were sore, my digestion was upset, and I frequently felt down and tired and frustrated. I was in debt and I was lonely. I allowed myself to feel like a victim.
Mm-hmm.
The people who were drawn to me wanted relief. I wanted relief too. I was already working so hard. How could I do more? So what I did was I started to listen to the messages that came from within.
Yes.
Listening to the body and discovering how to bring the unconscious into the conscious is an important first step towards health. We want to express rather than suppress our symptoms. The unconscious message is found there in the body, in the symptom.
Mm-hmm.
The body and the gifts are stored inside in the unexamined recesses of our bodies. Think about it. Every thought that we think, every bit of food that we digest, every process occurs in the dark, on the inside. The body has an amazing gift of renovation and change, and it's designed to heal. Every moment, cells are torn down and replaced with new cells.
Mm-hmm.
It's part of our glorious design. The body is just so magical and mysterious, and it's just wonderful. I cannot give my body enough appreciation at this point for all that it's able to do. And, the thing is, we take our challenges and our conflicts and we hold them inside, whether they're spiritual, emotional, relationships, whether we take in environmental toxins and we have to deal with those. We have physical problems and chemical factors, such as the food that we eat and the chemicals that are in, like medications that we take. Each one of these factors is modifiable and affect healthy genetic expression. I got really, really excited when I started learning more and more about genetics and found out there was so much that can be affected. We can affect our genes by how we think, by how we move, and by what we choose to put in our mouths. Mm-hmm. We have incredible control, and we are not victims.
Yep.
So that's kind of where I've gotten to from this point. And now I use genetics as a base of trying to find and design nutrition programs for people, because there's so much that can be impacted. We can impact our ability to make energy. We can help keep our inflammation down. We can stabilize moods and keep our brains happy. We can help to prevent disease, and we can detoxify better if our genetics are working well.
Absolutely.
And that's what methylation is all about.
So methylation is really become mainstream lately, but I think a lot of people aren't really familiar with methylation, what methylation does.
Right.
They know maybe about the MTHFR gene. I hear that a lot on a lot of the Facebook groups that I'm in, is that, oh, I can't get better, or I can't detox because I have this gene. I know that MTHFR is just a small portion of genes that affect methylation. So can you go into maybe what some of the genes are that can affect methylation, or how you may know if the body's struggling with methylation?
Well, I think first listen to the symptoms that the patient is having. But it's much more than that. You know, MTHFR is just such a small piece. What genes do is they code for enzymes. Okay, to make an enzyme in the body, you have to have a gene that tells the body to make more energy, and then that combined with a nutrient, whether it's a vitamin or a mineral, combined with methylation, is what makes those enzymes work. So when you're looking at methylation, you can't just plug in folic acid and expect methylation to work. The MTHFR gene has to do with the folate cycle. It's how folic acid works in the body, but it's only such a small piece. The first step is you have to be able to make energy. And so if you look at some of the genes related to that, the ACAT gene and the MMAB gene, you don't have to understand which genes they are, but what happens is you get genes go together. You get one gene from one parent and one gene from the other parent. And sometimes they have a risk factor associated with them. So if you have a risk factor from two parents, that means that gene only functions at 70%. If you have a risk factor from one parent, then that gene is only functioning at 30%. So if you add in specific nutrients, you can override or provide the building blocks to make the enzymes so that the body doesn't have to code for it itself. So you can turn on so many processes by impacting the different genes associated with methylation. And let me just read this one section, because I sometimes get it confused. Methylation is a process where there's a transfer of a methyl group, which is one carbon atom and 3 hydrogen atoms, onto amino acids, proteins, enzymes, or DNA, as it occurs in every cell of the body. So methylation is happening like 1 billion times a second in every part of the body and in all the cells.
Now, is the only way to tell if someone is struggling with methylation through DNA testing or genetic testing, or are there other ways to tell, or what's the most effective way?
Well, I would say the most effective way is to get a genetic test. And the genetic tests these days are much more affordable than they used to be. And just so you know, I'm going to be offering a discount on my genetic testing at the end of this presentation. But you can find out, you can there are like 15,000 genes, but the ones associated with methylation are about 800 genes.
Mm-hmm.
And you can easily get those tested for a fairly small amount of money. And you can then look and see which genes in your particular body are working well and which ones aren't working well. And then you can plug in the nutrients. And the doctor I studied with, she taught me that you have to fix things in a specific order. So it's not that you just throw in a specific nutrient. First, you have to know which nutrients turn on energy production, because if you don't make energy, then you can't, nothing else works. So you have to fix it in a specific way.
That makes a lot of sense. I mean, the body does everything in a specific way. So you have to supply what it needs in the way that it uses it. So, so what's involved with genetic testing?
Well, I use a totally private laboratory, which means they never, ever, ever would sell your information to another person. Whereas, like Ancestry and 23andMe, they sell to drug companies all of the time. They use your genetic information for drug research. But I use a totally private company. It is a cheek swab. You just rub a little, like a Q-tip kind of thing on the inside of the cheek. You send it into the lab, and about 3 weeks later, we get the results back. And then I get wonderful, wonderful reports. And what's exciting about the reports is I get a report on mood and personality. And what I like about the mood and personality report is it helps to know your autopilot. Now, you may not have any emotional problems, but I had a young man come in the other day, and he was beating himself up because he liked to do things different all the time. He liked to rearrange things. He wanted to do a different job. He was frustrated because he didn't always want things the same way. But we looked at his genes, and one of his genes on innovation and curiosity was like off the chart. He really needs to do that to keep himself happy. And so if you have a tendency for feeling depressed, for example, doesn't mean that you have to feel depressed. It can be, oh yeah, that's what I'm doing. I am allowing that part of me to express when I really don't have to.
Right. That makes sense.
And then, do you want me to tell you about the other reports that I get with it?
Yeah, go for it. I would love that.
Okay. So I get a listing of every single gene that they test. Occasionally there's one that the lab can't pick up on. It's not a good sample. But I get a report on every single gene. And from that report, you can look and see what exactly that gene does. It links, it's kind of an evergreen kind of thing, because it links to something called the RSID, which is SNPpedia. And that's where it has link that talks about every single study done on that gene up until now. So if you link on it 5 years from now, then that list has repopulated with more studies related to that gene. And then there's also a link to a specific study that shows how it ties in to the sliders that show your tendency towards different things. Because it's not one gene, one process. It's a combination of genes that create our tendencies and our abilities, and also how well we function.
So if someone, going back to the mood report, if someone is more geared towards depression, is it just the knowing that they're able to say, oh, I'm going down this route and I need to just kind of
No, that's
myself, or what can they do?
No, that's where you can look at what nutrients that in those reports, it also comes up with there's a questionnaire, and combined with the questionnaire and the genes, it comes up with a supplement recommendation.
Okay.
And then I use my test kits and my knowledge to help design a specific program for people.
Okay.
The other thing that's included is a diet and lifestyle report. So it tells you how well you use gluten and how well you use dairy, and whether you digest carbohydrates or proteins or fats well, and whether you're sensitive to tryptophan foods. The list just goes on and on.
Yeah.
So, for example, if you have a sensitivity to, well, if you have genetic tendency toward at 50% for dairy, you can maybe get away with having some dairy occasionally, but you probably wouldn't want it every day. If you have 100% sensitivity to dairy, then you probably don't want it at all. So you can kind of tailor your diet based on that. And there's links throughout all of these wonderful reports that explain, like what is a tryptophan food and what is a glutamate food. And there's links all throughout.
And go down all these rabbit holes and go deeper.
Right.
Okay.
So there's lots of information.
Would you recommend children or babies have a genetic test done? That way parents are aware of what may be triggers or things that they need to focus on so that their health isn't triggered negatively, down a bad route.
I think it would be a good idea, especially if the child has like chronic illness. If you have a child who has like constant ear infections and or always sick, or if you have a child with ADD or ADHD, then you can see, okay, let's turn on some of these pathways and just see how much improvement can be made. I think that there's still lots of benefit to all kinds of other coaching and all kinds of other protocols for ADD and ADHD, but it doesn't necessarily, but plugging in the right nutrients can make a big difference as well.
Absolutely. It's a more analytical, more, hardcore base. Just an analytical way to look at it. I know I personally like to do more analytical, and then I blend in the mind and the spirit, because I think everything needs to be blended together when we're dealing with people, because each one impacts the other.
I so totally agree, and probably I have a tendency to go mind, body, and then the analytical, because I've gotten stuck in my analytical mind over the years. People tell me I'm often too much in my head. So
it can be quite endearing to be in your head, but it can be hard as well. So, so how does, if methylation is impacted in somebody's health, what may manifest? Is it diseases? Is it just ill states of health? Or is it?
Well, I would say one of the number one things that people tell me when I get them on the program that works the best is that their energy has improved. A lot of people are low energy. Now, because I'm getting older, I will say a lot of my patients are getting older. So I perhaps have a few more people, and as we age, we don't make energy as efficiently.
Right.
But that doesn't mean that we should be accepting of that. I have had patients also with chronic Lyme's disease who I was chasing, like one co-infection and then another co-infection. People who have Lyme's disease often, they get past that initial infection, but then they are bombarded with a whole bunch of other little micro-infections that take over and cause all kinds of problems. And I find that turning on the methylation pathways is the number one thing that enhances immunity. So if we are enhancing immunity, then people don't get those little co-infections. I've also seen patients with chronic musculoskeletal aches and pains that things improve, with problems with mental health, that they're more stable. Not that my license doesn't allow me to take people off of medication, and I would never do that. But oftentimes people don't have to increase their medications. They feel more stable with less medications. And some people have been able to get off of their depression, anxiety medications. I've seen people sleep better. I've seen people take their A1Cs from 13 down to under 6.
Wow.
And it really impacts, like I said, those detoxification pathways. So, people who weren't able to do a detox protocol can now, if they're taking the right nutrients, can do a detoxification protocol because their bodies will let them.
Interesting. So perhaps someone, before they start to do a detox, if they're doing amalgam filling removals and want to detox, they want to make sure before they start any of that, whether or not they can detox and what they need to do to support their body for a successful detox.
Absolutely, because I'll tell you, getting your amalgams taken out without the proper nutrients can make you really, really sick. I've seen that with people. And then it can take you, 6 months or a year to get better. And people don't have that kind of time. People don't have that. People can't take a month off of work to recover. So turning on processes is a big deal.
So I'm just wondering, because it is a gene expression, I guess that would be the way to kind of label it, or a lack of expression. Does that mean they need to be on these supplements for the rest of their lives that kind of give them the support, or can they change things through supplements initially and then do more nutritional to continue, maintenance?
I would say it's probably half and half. Some people, and probably it also is age dependent. So, older folks might need to stay on more nutrients over their lifetimes because, again, their bodies may not be as efficient as they were when they were 20.
Right.
If someone's had mitochondrial problems, sometimes the mitochondria can just be healed. So they only need to take nutrients for the mitochondria for a period of time. I would say if you have the MTHFR polymorphism, where you have trouble with the folate cycle, or the MTR or the MTRR, which relate to vitamin B6 and B12, those would probably need to be taken in their active forms for a lifetime.
Okay.
Because I don't think you convert well. That's the issue, is if you have that weakness from both parents, you don't convert your B vitamins from foods very well.
Okay. Does the methylation process affect mitochondrial function?
Big time. Yes, absolutely. Okay. So because there's a number of the B vitamins that go into the process to make energy, that along with coenzyme Q10, L-carnitine, alpha lipoic acid, the list goes on, and it really depends on the individual. Everybody is a biochemical individual, and there's no one size fits all.
Fantastic. I think it's amazing. I know myself, I have seen tremendous increase in when I support the methylation pathways, and I haven't even gone as deep as you have at looking at what the actual genes are involved in that. So, just the fact that you do dive deeper and can give a much clearer picture about exactly what someone needs to do to support themselves just means, hopefully faster healing or getting to a better place, but more appropriate. And we all want more energy, to feel better, to not have chronic pain all the time. So if
Right.
by doing this, you can get yourself on the right route to do it, why not? You
Right.
were
Why not?
mentioning, oh, sorry, I didn't mean to cut you off.
No, I said, you're right. Why not?
And like you said, I mean, it has gotten much more affordable. I remember, gosh, even 20 years ago, when I was looking with my mom has had breast cancer at the time, and they wanted me to do all these genetic tests. And I was like, oh my gosh, the money, and then going to the counseling for the genetic testing and all this stuff, I was just scared me away from it. So to see how accessible it is and how the reports are so clear in what they provide, it's much easier. As you were showing me last time we talked, the reports, it just is like, wow, I could understand that.
Well, and what I like about it is it's about what you can do. It's not about what to be afraid of.
Right.
The medical approach is, oh my gosh, you have your BRCA gene, you better get your breast cut off and you better have your uterus removed. It's all based on fear.
Yeah.
And they don't test much. They test one gene. What does that tell you? Like, I had a patient with serious mental illness, and they were not getting to the bottom of it. And she showed me her genetic report, and they tested one gene, one. And, that really, what does that tell you? It tells you nothing.
Right. Right.
So little.
We are we're all processes. I mean, there's so many millions of processes going on in our body at any given time. And one thing that's deficient here impacts everything else downstream,
It certainly does.
And it always floors me at any labs that I look at. They always seem incomplete, right? Like, oh,
Right.
one thing is tested here, one, and I'm like, there's no complete picture for anything. So
No, there really isn't. And I pulled out my Happy Genes blood worksheet. And what's kind of interesting is that you can look at a blood test, and then you can look at the genes associated with that particular blood test. It's kind of fascinating, and so much of it has to do with our immune function. We really need to boost our immunity. And one of the big genes that we look at is called the VDR, and it has to do with how well the vitamin D works in your body. And I know a lot of people take vitamin D, but when I've tested them, what I find is a lot of them can't even utilize their vitamin D. I do a lot of muscle testing. That's just kind of how I determine it, in addition to my looking at the genetics. And some of these people can't use their vitamin D because their genetics say that they need vitamin K to make it work. And sometimes people need vitamin D and K and A, depending on their genetics, to actually turn on and send the messages from vitamin D to the different cells of the body.
And that's why it's important not to just go by the vitamin D levels on the lab work. You have to know synergistically what that person's body needs. Different medications like birth control even impact vitamin D levels. So it's great to dive deeper and figure out where you need to go with that.
Well, and birth control majorly affects the B vitamins, especially the folate pathways. So the vitamin B6, the B12, and the activated folate are really, really important when you're taking birth control pills.
Absolutely.
Especially when you come off, if you want to have a baby, because you have to have that activated folate in your body at the moment of conception to help to prevent birth defects.
And, that's a bone I have to pick with the industry, right? Is so many women are on birth control and they don't know that. And then they go off and, as I see these rates of birth defects and things going up, I just have to just question, and who knows, I haven't done any studies if it's because of that, what's happening. And
Well, I've looked, they say go buy a prenatal, and I've looked at so many of the over-the-counter prenatals and they're terrible. They don't have the activated B vitamins. And especially at the beginning of pregnancy, when you're kind of nauseous anyway, you need to have whatever you take be in an absorbable form so that your body can actually utilize it and stay healthy.
Now, if the methylation pathways are not working properly, do you recommend methylated vitamins? Is that what someone would normally be looking for then, would be methylated?
Yes, the activated forms of the B vitamins. For example, most over-the-counter B12, for example, has cyanocobalamin, and that is not a methylated form. Methylcobalamin is the methylated form. What it means is your body can't convert from one step to the next step. So activated folate is L5-methyl tetrahydrofolate. And so it means you can't convert folic acid, and most over-the-counter supplements have folic acid. You can't convert that into that next step. So that's why you need those activated forms.
Okay. Now, if someone takes an activated form, but they don't need it, does that?
It's not going to hurt them.
Okay. That's
in fact, the multivitamin, the people who don't want to do genetic testing, most of the time I give them the multivitamin with the activated forms of the bees.
Good. I just wanted to make sure. I don't want anyone worried out there. Now, you mentioned that you were willing to offer any of the listeners a discount on your genetic testing. Was that what you were saying in the beginning?
Yes, that's what I was saying. And what I will say is that if you're not sure, what you should do is just contact me. And Dr. Alexi, you can include my contact information, and you can schedule a time with me to just do a consultation, a phone consultation. We can talk for 10 to 15 minutes to see if you indeed are a person who would benefit from genetic testing. So that's totally free. And then if you decide to do a genetic test, my typical charge for that, there's a lot of my own fees associated with this, just so you know, is $695, and I'm giving people $100 discount if you mention this.
Thank you so much for doing that. I think I recommend everyone have a genetic test done. I think it'll give you answers to a lot of underlying things that you may be experiencing. So thank you so much. Any closing words that you have for anybody? Any thoughts that you want to leave them with?
Let me just think. Just, trust that your body knows what to do. Your body holds all the answers if you just know how to ask the questions. You have the power to change your life, change your world, change your body. Life is a delightful, wonderful, expansive, occasionally painful gift. And the magic and mystery of this life matters.
Yes, I love that. Thank you. Thank you, Dr. Prahl, for your time. I really appreciate it. I will include all of your contact information in the notes. So if anyone wants to reach out to you, again, thank you. I appreciate it.
Thank you. It's been fun.